Kia ora, welcome to our COVID-19 live panel. My name's Hannah Martin, I'm a health reporter here at Stuff, and today I'm joined by Epidemiologist Professor Rod Jackson, GP and Home Isolation Program Director Dr Christine McIntosh, and Immunologist Dr Anthony Jordan. We've been inundated with reader questions, so we're going to get straight to it. Rod, this first one is for you. Some modelling in recent days and weeks around the Omicron outbreak has predicted many hundreds of cases by this point. And we're seeing that a little bit, but not really what we had been told to anticipate. Why is that, and when do you think that might start to change?
Well, if you listen to what the modellers actually said, they said that in the next few weeks we're going to get these large numbers. And I think that's absolutely clear. We're going to get big numbers. But, you know, right now we're in the opposite of a perfect storm in that we probably have peak immunity. It's summer. We've got the red traffic light system working, so everything's in our favour. Kids have just gone back to school, so it's kind of perfect timing to get Omicron, if there is such a thing as perfect timing. But I think it's clear, unless we're unlike almost every other country in the world, we're going to get thousands of cases in the near future.
Okay.
Yeah.
Okay. And Christine, this then sort of leads on to dealing with when we actually do have cases, or when we are cases. What is your advice for people right now at home? How can we start to prepare? What do we need to be thinking about having in a practical sense for when we do contract COVID-19?
Sure, and I think actually now is a great time to prepare because we do have these lower case numbers at the moment, and it is coming, and I think that's your part there, isn't it, Rod? It's coming no matter what. We're seeing the lower numbers now. So what can we do to prepare? Well, the first thing obviously is to be vaccinated. Okay, it's really, really clear. Triple vaccinated, triple vaccinated, triple vaccinated. It's really, really clear that people who are vaccinated are going to get a far less severe disease. Okay, they're much, much less likely to go to hospital. They are likely to be either asymptomatic or have a really more mild illness. So getting prepared now is getting prepared for the fact that you might need to stay home.
Yes.
Okay, it's if you get Omicron, if you get COVID, you'll need to stay home. Your family or your household will also need to stay home. And at this stage it's for 14 days, and for your contacts in your household it's a further 10 days as long as no further cases occur in your household. So that's quite a long period of time, so you need to be prepared for that. So you need to have some extra food. The way that my family have done it, we've picked up a couple of extra packets of paracetamol when they're at the supermarket, because actually what you're going to get is some body aches, feel a bit achy, and you might get a bit of feverish, you might get the sore throat, more sort of cold type symptoms. Omicron is more of an upper respiratory infection for many people, especially the vaccinated. So I think that's about being prepared for that. It's also preparing your friends and family, understanding who it is in your neighbourhood who you can support and who can support you. So it's planning ahead and thinking about the things that you can do, such as reaching out to elderly neighbours and saying, can I do your shopping for you if you're worried? If something happens, you know, I'll get your shopping for you, I'll help you out and drop things off in your doorstep when you need them and things like that. So I think it's some simple things. Get some simple medications. If you've got medications that you need to take, make sure you've always got 2 weeks supply. Okay, there's not rushing out and getting everything all the time, you know.
Sure.
Just got a bit of preparation.
Okay, great. And we had actually the same question from a number of concerned parents wondering about the practicalities of if their child comes home and has COVID-19, actually just working out how to isolate apart in a family. Can you sort of talk us through what that...
Yeah, absolutely. And that's a really common question that people have. How on earth do you isolate apart from your child? The reality is you can't, and you should not. Your child needs you. And I think this is really clear that your children need you, and you need to comfort them when they are unwell. Interestingly, most children will have a fairly mild illness, but no, you don't need to isolate away from your children. You need to support your children through that. And yes, you may get COVID in the process. That's the reality of it. Best thing that you can do as a whānau to be protected, be vaxxed.
Thank you, Christine. That leads into a question for you, Anthony. We've heard a lot about how important boosters are against Omicron. Can you talk us through what sort of protection a booster gives you, and how long that immunity against Omicron or COVID-19 as a whole lasts.
So the last question is probably the hardest question to answer, so I'll start with the first part of that. After about 6 months, you start to see the effect of the 2-dose regime start to fall off quite significantly. That's for all types of infections, and it probably hits somewhere around the late 30s, early 40s. That's not necessarily the case for hospitalisation and severe illness. It probably holds up a bit better for that. When you get your booster, it comes almost back right up to that late 80s, early 90s. So that's the benefit of the booster. It's taking care of any type of infection, but also boosting that hospitalisation protection and severe illness. How long will it last for? You know, million-dollar question, probably multi-million-dollar question. Generally, what I would say is if you look at vaccinations in terms of most vaccination series would have 3 doses in them, and that they would space it out, and that final one gives that sort of kick for a bit of longer immunity. So I wouldn't be surprised if we see that much longer protection following the 3rd dose than we've seen after a 2nd dose. The other part to that is, you know, Omicron is not the end of this, and we've heard that before, is that we need to think about what is around the corner in terms of new strains, and although it may not be a booster of the same vaccine, we need to think about, well, how do we prepare if there is another strain as well? Similar to what we talk about with flu vaccines in terms of changing strains every year. Coronavirus in general, in sort of pandemic senses, is different to flu. It's probably something that'll run for a couple of years and then, fingers crossed, go away.
Okay, and that actually, there is another question that we had a lot related to that. What are your thoughts on how likely it is that we will need recurrent boosters in the future against COVID-19?
I would say to people, don't worry, we just need to get through where we are now. Let's get through Omicron, let's get boosted, let's deal with the current situation we have. There's amazing scientists, epidemiologists, primary care physicians, immunologists working on what's coming next, and that's all we need to know, that someone's on that game to make sure it's happening.
Okay. I mean, just to add to that, it is quite likely we're going to need something new, but I don't think we should take that as any sort of criticism of what we've got now. I mean, you know, if there's one thing that I have predicted most badly, it was how quickly we would get vaccines and how good they were. I mean, I'm sure you would agree, is that these vaccines are beyond our wildest expectations in terms of how fast we got them and how effective they are. So, you know, if we need another booster sometime, it'll be a different one. It's likely to be better because there's probably 1,000 groups around the world working on what is that message we want in that vaccine. How can we actually get that, tweak that message so it works for much, much longer? So, you know, I'm confident that our vaccines will only get better.
Great, that's great news. In the meantime, I wanted to ask about masks. And we've got a great array of masks being worn here today.
I've got the best one.
Yeah. Well, so we've had a question from Janet. Her question was, what's the deal with cloth masks? Are they redundant now? Do we need to throw them out?
Well, I mean, we probably all have a comment on that. So I've got an N95 mask. These guys are wearing surgical masks. There's no doubt that this one, if you're with a patient with COVID, you guys would be wearing something like this, okay?
Absolutely.
Like this. The thing about cloth masks is that there are some fantastic cloth masks, but there's also some terrible cloth masks. And so I think the general public message has been ultimately we should be going for something like an N95, a P2, what they also call a respirator mask. In future, that would be the ideal if they're available. And cloth masks have not been pushed because how do you describe a good cloth mask? But some of them are fantastic, but some of them are terrible. And so I think that's the reason that there's been a bit of a down. Would you agree that that's why I think there hasn't been so much support for cloth masks? But the N95, the P2 respirator masks are ultimately going to be the most effective masks.
think you
Would
need
you
to wear
agree?
the right mask for the right situation, though,
Yep.
and it's really clear what we need to do in a health setting
Yep.
is something different to what you need to do in the supermarket. So I think that's,
Right.
we have the right personal protective equipment when we're in a health setting, when we're dealing with people who may have a COVID infection. It's really important that we have the right personal protective equipment in that situation. So it's the right mask for the right job.
Sure.
Yep.
Okay.
That's a fair point. Yeah.
And the other thing I would say is just in regards to masks work better when everyone wears them. So, you know, Rod in his mask and none of us in other masks is not a great way of stopping COVID. All of us, like in masks like Christine and I, you see better protection.
Yeah.
So
Yeah.
I think it's kind of a ladder, like Christine was talking about. You use different masks in different situations. But if in general you wear any mask, that's a good step up the first
Better than
run.
none, isn't it?
It's better than none. So if we can get
Absolutely.
everyone on the ladder first, and then saying, you know, these medical surgical masks are a little bit better than the variability in a cloth mask, you get a bit more protection. And then in certain situations, those masks are really, really good. And so you'll see that advice sort of change as the outbreak goes on, where they may become more common in certain settings. But for most of us, like Christine said, going to the supermarket and these is okay.
Sure.
But definitely don't chuck away a cloth mask for no mask.
Yeah.
Yeah.
Good point.
Good
You've
to know.
got to remember what masks are for, and actually part of this is the droplet spread that we are doing ourselves, and actually they're a really important part of that, and part of that's protection the other way. But actually a really important part of it is the droplets coming out.
Yeah.
Yep,
It's a
yep.
two-way.
It's a two-way thing.
Yeah.
Sure.
Both directions, yeah. And I'm quite familiar with wearing a mask. We wear a mask all the time within the COVID centre just to make sure that we're all, you know, we seem to be quite important at this time, so it's making sure that we're all protected, and and we're quite familiar with wearing masks in our environment.
Sure, great. The next one might be for either one of you or both of you, actually, and it could be a bit of a crystal ball gazing question. We've had a couple of people get in touch about wanting to travel domestically under the red setting, you know, to enjoy some sort of semblance of life as normal. But people are concerned, particularly about A, travelling, and B, having to isolate if they end up somewhere far from home. So I guess there are two prongs to this question. One, should people be deferring travel and staying close to home while we are seeing Omicron ramp up?
Yeah. Do you want to answer that straight off?
Yeah.
Well, it's the perfect question for me because on Saturday I'm meant to be flying to Queenstown and then driving up to Aorangi Mount Cook to cycle to Oamaru. And at the moment I'm planning to do that. I'm triple boosted, so I'm prepared. Triple boosted. I've got a good mask. I'm going to follow all the rules on the plane and when I get, at the airport. I've also organised for a place to stay if I'm found out to be a close contact or if I get Omicron. So I think if you're going to travel, you need to plan ahead and you need to be ready to pay for or at least have
Stay in place.
to stay in one place. So I think it's all about planning at the moment. And at the moment, unless something changes between now and Saturday, I'm on a plane to Queenstown on Saturday afternoon.
And I think that's really important. It's all about planning at this stage, and I think it's about not stopping what we need to do in our lives, the important things that we need to mark into families and things like that, but it's actually requiring a bit more planning now.
Right.
It's what will happen then, how can we stay in place, how will that work, what are the implications of that? So just working through all of that before you head off is really, really important, because that bit of planning makes a really big difference if that ends up being the situation.
Sure. And that was the second part of that
And I'm
question.
taking my COVID kit too.
Well, yes.
So I'm
what's in your
taking my
COVID kit?
Panadol, I'm taking my throat lozenges, a thermometer. I actually got a pulse oximeter. I don't know whether you need it.
No,
it's probably
no,
good.
I'm going to cut your kit
Okay,
down.
good. Okay, I'll take that out of
I'm
the
going
kit.
to cut your kit right down.
Yeah.
I think you need some paracetamol.
Good. She's the expert here. So
Throat lozenges are optional. You can have a warm drink, settles the sore throat really nicely. What else did you say? Your thermometer. Most
thermometer.
people know if they've got a fever. You feel a bit
So you don't
rubbish
think I
when
need
you've got
that?
a fever. You can feel your child's fever. You don't need a thermometer. You know when you've got a fever. It doesn't make a difference to what you need to do right at that moment. Yeah. So what did I cut it down
Oh,
to?
and
You've
I-
got toilet paper.
Oh, toilet. Well, I think there's going to be toilet paper there. Am I meant to have toilet paper or
You
not?
need something to wipe your nose with.
But no, but I did have this. I did buy a pulse oximeter. I didn't know whether I needed one, but I just like measuring stuff. So I'm one of those people.
You're an epidemiologist.
I'm an epidemiologist,
Yeah.
so I live to measure. So,
So what the
but I
Delta,
don't need it.
no, the,
Oh, that's
the
good.
Delta outbreak has taught us is actually we know the people we need to focus on with the pulse oximeters, and I think that's a really important thing. Not everybody needs a pulse oximeter, and not everybody needs to do those recordings. Okay, I think that we can all determine the symptoms that we might have that might just suggest that we're a bit short of oxygen.
Yeah.
So if you suddenly you find that getting up from your bed to go to the bathroom or to go to the kitchen makes you really short of breath, you're feeling extremely lethargic, that you just can't get out of bed and do things. These are the things that are raising concern, okay?
Right.
So it's really important to listen to your body, what your body is telling you, what you're seeing in your family members. And if you see those sorts of symptoms, you need to call for help, okay? People who are really just finding that they just can't even do the basic things they need to do.
What would Omicron look like for most of us?
Well, I'm hearing from our South Auckland GPs at the moment, so Pacifica GP working in the Pacifica community that are currently experiencing Omicron out there. It feels quite different to Delta. The majority of people, particularly the people who've got vaccination, are not particularly unwell, okay, which is really good news. And it means that we can handle this differently to how we did Delta, okay? It means that, yes, we still need to isolate, we still need to contain the infection, we still need to contain how quickly it spreads through the community to preserve the capacity within our hospitals. But actually, as a whānau, if you're vaccinated, you've done all the things that you're prepared, then this is going to be some time at home, but for most people it's not going to be really awful. Okay?
There is a big but, and
But?
that's if you're not vaccinated.
If you're not vaccinated,
Yeah.
really concerned.
Because
okay?
the evidence is increasingly clear that if you're unvaccinated, it's not that much different from previous variants.
That's right.
Maybe just 25% less severe. And you've got to be really careful about looking at international data, because most of the unvaccinated
Have had
in
it.
other developed countries
Have already had COVID.
have already had COVID. And if they've survived Delta, they've got some immunity.
Yeah.
So New Zealand, unvaccinated New Zealanders mostly have zero immunity.
Yeah.
So Omicron is not that different from other,
Yeah.
from other variants.
So that's when we're thinking from a whānau HQ program point of view, that we are particularly keen to link up our unvaccinated, our people who are at higher risk if they get COVID, to make sure that they're linked in with care, and that we keep a really close eye on how they're doing. So we've been able to have the luxury of a bit of time to see how it's rolled out in Australia and things like that, to think about how we do this in New Zealand and how we're particularly doing this in Auckland, is making sure that we're particularly focused on those people who will be at more at risk with their COVID, who are likely to get more unwell, and that we're really honing on to care for those people and wrap that care around.
On the topic of vaccination and coverage more generally, we've had a few questions come through about the 5 to 11 age group, seeing as the vaccine rollout has just started for this group. How protected are they against Omicron, given they will have only had one dose?
They're actually really well protected. The one thing that we need to realise about the immune systems of 5 to 11-year-olds, they're incredibly potent. The responses that they produce, after triple vaccination, we're probably approaching what they get after one dose. And if you look at it, 70-80% after one dose. And, that creeps up over time, like any immune response, but that's pretty good. I wouldn't sort of turn my nose up at that at all, because the majority of the gain is after that first dose. Yeah, your second dose takes you up another 10 to 20%, but the bulk of your gains after that first dose. So I would tell people, getting your first dose is the most important thing you can do. The reason that we have an 8-week recommended gap at the moment is twofold. A, that gap, extending it out, tends to improve the longevity of that response, and the second bit is to reduce any side effects. So those are two things that, for parents they should be aware of. Is that's why we're recommending 8 weeks.
Okay.
I think there's an important message there for other people who have not yet had their first vaccine too, is that one vaccine is a really good start to your immunity, and it's not too late to do that.
Totally.
And that would be, if you haven't yet had your first dose, it's a really good time to get your first dose.
February. I believe, in terms of, that very first question about modelling, we don't quite know when it's going to happen. I'd be really surprised if we don't see, large numbers of cases in the next month, which means that February is the time for those who are unvaccinated to get their first dose. And, if you're a parent and you want your kids to stay at school, that first dose is really, really important, because that actually will stop a whole lot of infection as well. So it's really important for not only your child, but also for the other children and for society and for everything to keep working, for our kids to be going to school, for people to be going to work. Vaccination is going to have a huge impact on all of those factors.
And so our booster rollout has been picking up, at quite a good pace since it's begun. But we've had a couple of people asking why people under the age of 18 are not eligible to be boosted, and when will they be?
Sure. So that's a good question. So in the United States, just before Christmas, they approved 16 to 18-year-olds to be boosted. Then after Christmas, they approved the 12 to 16-year-olds to be boosted. They're one of the few jurisdictions that have actually approved boosters for that age group. And generally that's because, again, the immune response in teenagers is similar to 5 to 11-year-olds. It's robust. It probably lasts a lot longer than some of us who are a little bit older or have other conditions. So that need to boost that population needs to be balanced really carefully about, is this a useful intervention when we look across the world? Getting first doses into some people around the world is much more important to end a pandemic than getting a third dose into a group of people that probably have fantastic immunity anyway. The second bit is actually boosters are important for those people that have evidence of significant waning, and there is an age difference in there. So I think we should just wait and see. I don't think we need to race out. Remembering our 12 to 18-year-olds are relatively well vaccinated in the world setting. They came on, later in the second half of 2021, so they'll have pretty good immune responses even now going into February and March.
I think we have to be clear what we're trying to achieve with that too, and this is about risk of hospitalisation. When we think of risk of hospitalisation, you talk about the health system protecting the hospitals, so the hospitals are there for the other things that we need them for. But as a family, what that means is that we're not getting severely unwell. So, and I think that's really important to put in context for younger people who haven't had their booster, is that they have already had a vaccination. They've had their vaccinations, and they are being protected against that risk of getting more severely unwell already, okay? And so I think that it's important to put it in that context about what it actually means for your family and your whānau, and it is about not being so severely unwell.
But it is, there's always a but to all of these things. The boosters will have a huge impact on slowing down the spread. Because, aside from the severe disease, the big thing about Omicron is that it spreads so rapidly, and that's what overwhelms all systems, hospitals, schools, supermarkets, supply chain, is that speed of spread. And there's no doubt that booster has that additional huge impact on just slowing it down. So,
boosters and isolating effectively.
And isolating and masks, and, all of these things. I guess I mentioned it earlier, the fact that we only have a few hundred cases reported, there could be double or triple that at the moment, but it's not thousands, is because all of these things we've been doing work. And I have to say I'm more optimistic than I was even a few weeks ago. It demonstrates that we do have a whole lot of effective interventions against Omicron. We're not going to stop it, but boy, we can limit its severity in terms of its impact. We can limit its impact on New Zealand.
On that,
Yeah.
Neil has a related question. Omicron is obviously very much front of mind.
Yeah.
But where has Delta gone? Has Delta gone? and if it has not gone,
Yeah.
can you possibly get both strains?
Well, the answer is yes, you can. Yeah, but you have to realise that this is all very recent. How long has Omicron been around? Since the end of November,
Yeah.
reported. But it seems pretty certain that if you've had a recent Omicron, that gives you some protection against Delta. Is that fair? I mean,
Yeah,
you're the expert.
yeah,
So
definitely.
they all give protection. So at the moment, Omicron is pushing Delta out, but you can get both. And the longevity of immunity, I'm moving into your territory, the longevity of immunity seems to be greater with the vaccines than with infection. You might want to explain that a bit more.
Yeah, and I think that's generally a good view of it. I think a comment you made earlier is that in New Zealand, most of our population are protected from COVID through vaccination. And that's a very, very effective strategy. If you look at countries where they've had widespread waves of COVID going through, you can see clearly people are getting reinfected.
Yeah.
Alpha, Delta, Omicron. So that should be in people's mind. If you look at the vaccinated population, you don't see as much of that. You see a longer level of protection. They may get another wave, but there is that longevity of protection through vaccination. So that puts us in an incredibly good space. I suspect that's why we see our numbers, flattening off a little bit, because people have got that message that vaccination is the way to protect yourself for a longer period of time against future strains as well. Remember, Pfizer has still held up really well against Omicron. Despite what we were worried about in November, yes, you need a booster. Still works when you get a booster.
Yeah.
Okay. And so Rod's mentioned we don't yet know when this is all going to happen, but winter is on the horizon, and we've had a couple of immunocompromised people get in touch to ask, coming into winter, aside from getting their booster and taking the normal precautions that one can, should they be isolating? Should people be on some sort of self-imposed isolation as we kind of head into the winter months? What are your thoughts on that?
Yeah, I think it will be different for every individual. There'll be some people who are very risk averse and they have already spent a lot of time isolating. There'll be other people who may be on lower levels of immunosuppression or very well controlled immunocompromised states who have been vaccinated, for example. They've had their third primary, they've had their booster, and actually their risk for them is starting to approach what the risk is for the rest of us, and they may be comfortable doing that. I think that's a decision for each individual person to make. Remembering isolation is not good for people. We forget.
That was what I was going to say. Yes, that we actually do have to do some living too, and I think it's really important to balance that out. And I would encourage people to go and talk to their GP about that if they're feeling uncertain about what they should and shouldn't do. Is that have a discussion with their GP about it.
Okay. And just finally, I'll ask you to get your crystal balls out again. We are in the sort of third year now of the pandemic. What is the end game here? When will COVID-19 be over? What does that look like?
That's you, Rod. You get to go first.
Well, I don't know. I always remember at medical school that my teacher said one of the most important answers that you can give is I don't know. And we just don't know. But what I do know is this. One, New Zealanders have done a fantastic job at getting vaccinated, at following sensible rules about how to reduce infection. So I think, New Zealanders amazing. I think New Zealanders are amazing, with what they've done. The second thing that I'm pretty certain about is we're going to get much better vaccines in future. These ones have been brilliant. The next ones, I think, could be superlative. So those are my positives. The negative thing is the don't know. I mean, we just don't know what's going to happen. There will be more additional strains. We don't know whether they'll be more severe or less severe. So we've got those. But boy, are we going to be well prepared. I think the world is much better prepared, and because we've been the last to get most of these things, we're going to be better prepared than anyone. And if we work together, I think that we can get back to. It might be a new normal, but it'll be pretty normal. Actually, I was out yesterday. Well, I've been out today. I'm amazed that the streets are full. People are working. The motorways are totally full. The streets are full. Cafes not so good. I think there's no doubt that hospitality is suffering. I'm going to try and do my bit for tourism on the weekend for local tourism. But I'm sort of hesitantly optimistic for New Zealand. Yeah, that's where
I think your key point about being prepared, I think we are well prepared. We've had the lead time compared to other countries. We are in a space where we're better prepared. As a whānau HQ program, we're in a good space at the moment. We know that we're going to share the load across the system. We're ready for that surge of cases that's coming. We understand we have to balance that against doing all the other things that we need to do in healthcare and primary care and so forth. And so we encourage people, if they need healthcare for other reasons, to seek it as well. But we are in a better space, and I think that we have to get used to a new normal. I think we have to shift our frame a little bit and think about that new normal. But I think if we as a system are prepared, and as families and individuals we're prepared for what's ahead, I think that's going to put us in a really good space again ongoing. So, yeah.
Great.
I'd completely agree with all of the comments. I think one of the things that I really encourage people is don't think about what it was like before. Our future state will look different. As Rod said, a new normal. As Christine said, we've got to prepare for things. So, everything can improve. And actually, what we are learning now will put us in, really good stead for strains that may come in the future, pandemics that happen in the future. What has happened is we've had decades of possibly a little bit of complacency in terms of, not seeing viral pandemics or other things that have threatened our healthcare system on such a large scale. So this is for us, we've got to not forget the learnings of what we've just been through and keep that going on to keep the population and the healthcare system prepared for if this ever happens in the future.
Sure. Okay. Well, we will need to wrap it up. Our experts need to get back to their normal mahi, but thank you very much for joining us today and for your time, and thank you to those of you who sent through questions. I apologise if we weren't able to get through them all. In fact, I know that we couldn't. So if you still have a question, please feel free to get in touch. Our contact details are on the Stuff website. Have a great afternoon. Mā te wā.